Bismillahirrahmanirrahim. Assalamu alaikum to respected audience. Today our topic of discussion is ruptured retinal artery macroaneurysm. Its pathophysiology is that it is an acquired focal aneurysmal dilatation of an arteriole, usually within the first three orders of retinal arterial system. Usually, the incidence higher is seen in elderly female patients, and there are arteriosclerotic changes in these vessels have been seen which lead to focal ischemia. There is also remodeling of greater intimal collagen, and after this remodeling, the dilatation of vessel diameter occurs. And ultimately, there is some break in the arteriolar wall, which leads to fusiform dilatation and rupture. It has three types: quiescent ram, hemorrhagic ram, and exudative ram. Quiescent ram is innocuous. It doesn't cause much problems. You can see it is secular fusiform dilatation like this. Hemorrhagic, that's a little bit serious because there is hemorrhage, it ruptures and blood spreads in the retina. While exudative ram is there where you can see some hard exudates over there which have leaked out of the blood vessels and their deposition is over there. Now this is our interesting case towards which we are coming now. This is a female lady, 65 years old, came to the emergency and her blood pressure was 180/70, although she was on antihypertensive drugs. In this slide, we can see the hemorrhage, almost it is occupying the whole macula in the left upper picture. While we look towards the right one, this is OCT of the same patient, and it shows just under the dome hyperreflective area at the level of this hemorrhage, and under this hyperreflective area is serohemetic fluid. Now coming to the next here. Very clearly I have mentioned number 1 and number 2 box. Number 1 box is the ruptured arterial macroaneurysm in the macular area, while if we look at number 2, this is also a macroaneurysm which did not rupture but involuted. So the patient was there with us in emergency. We started first of all the controlling of the blood pressure, which was very high. We took advice from our medical colleagues for the management, and we also advised FFA, fundus fluorescein angiography. We did FFA, and we can see here in number 1, we can see leakage. While number 2, it is involuted, there is no leakage. So after controlling this blood pressure, which was quite high, we planned for intravitreal Avastin. There are many treatment options: lasers, anterior hyalodectomy, Avastin, but we opted for this intravitreal Avastin because in this case this was the best option. And after that we gave a follow-up to this patient. So it was a very interesting case, so I decided to share this with my audience, that patients with high blood pressure can have ruptured arterial macroaneurysms.